Hi, I'm Cheryl Dale and I'm a nurse practitioner in hepatology. Today I'm going to talk about hepatitis C. You can visit our website www.liverinfo.com and print off a copy of our hepatitis C pictopamphlet to follow along with this video. You can also find much more information about hepatitis C on our website www.liverinfo.com. What is hepatitis C? Hepatitis C is a viral infection caused by the hepatitis C virus. Hepatitis C can only be contracted through contact with blood infected with hepatitis C. This blood must come in contact with your blood. Some ways this can happen is through sharing unclean equipment for tattoos, piercings, pedicures, and manicures, sharing needles for injecting drugs, sharing toothbrushes or nail clippers, rarely sexual intercourse, or having received a blood transfusion prior to 1990. Once the hepatitis C virus enters the bloodstream, it travels to the liver where it attaches to healthy cells. Hepatitis C virus takes over these liver cells and forces them to make more copies of the virus. Think of it like this. Hepatitis C enters liver cells where it takes over the cell machinery. Instead of performing normal liver functions, infected cells are reprogrammed to make new copies of the hepatitis C virus. Once these new copies are assembled, they cross the liver cell back into the blood. This damages the liver cells and causes inflammation. In other words, liver cells are used to help build new hepatitis C virus and are damaged in the process. Your liver is a very important organ in the body. It works 24 hours a day, performing hundreds of vital functions for your body. There are many different types of hepatitis C. These types are called genotypes. In fact, there are 11 different types or genotypes of hepatitis C. The commonest genotypes throughout the world are genotypes 1, 2, and 3. It is important to know what genotype of hepatitis C you have because it predicts how you'll respond to treatment. What is hepatitis C going to do to me? When most people are first infected with hepatitis C, they have no symptoms at all. Others might feel tired, lose their appetite, and their skin and eyes might turn yellow. In some people, the immune system can actually fight and clear hepatitis C virus. These people recover completely. In other people, the virus cannot be cleared. In this case, the virus continues to irritate the liver. This is called chronic hepatitis. Chronic hepatitis can lead to scarring of the liver. Scarring of the liver is called cirrhosis. In rare cases, hepatitis C can even lead to liver cancer. Many people with hepatitis C have no symptoms until the liver becomes scarred. Once this happens, it cannot be reversed. That's why it is very important to detect and treat hepatitis C. What can I do about hepatitis C? If you have hepatitis C, your family doctor should refer you to an expert in liver disease, a hepatologist, a gastroenterologist, or an infectious disease specialist. A hepatologist is a specialist doctor who is an expert in treating liver diseases. An infectious disease specialist is an expert in treating chronic infections. These types of doctors are in the best position to help you diagnose and manage your condition. Not everyone with hepatitis C needs treatment with medications. If hepatitis C only causes slight changes in your liver, then treatment may not be necessary. However, for others, treatment is aimed at clearing the virus from the body. The types of medication and duration of therapy depends on a number of factors. For most patients, a combination of PEG interferon and ribavirin is the recommended treatment. If you have genotype 1 hepatitis C, a third antiviral medication should be added. The goal of triple therapy is to cure hepatitis C. This means the virus is no longer detectable in your blood 6 months after the therapy is complete. Here are some other recommendations on what you should do. Learn as much as you can about this disease. Let your family or others who you live with know about your hepatitis C. Attend your medical appointments regularly. Get your blood tests done as suggested by your doctor or nurse. And finally, learn about the medications used to treat hepatitis C. I do hope you found this video to be useful. For more information, please refer to our website www.liverinfo.com.